Does medical school make you racist, sexist, and ageist? Hello and welcome to the channel. I have been meaning to address this issue for a while because I think it is important for the general public to understand how a doctor is trained to think. Not least because it will help you understand why a doctor asks you certain questions in what we call history taking and why he or she may choose certain strategies for your medical care specific to you and not for someone else with the exact same symptoms. Medicine may be a science, but I see it more and more as an art. By the way, I have deliberately misspelled the controversial words in the title of this video to avoid any YouTube policing. I hope this does not occur, but if it does, I shall have to find another way to circumvent that and find a way to let you know. The police all over the world are known to be proponents of profiling. In some countries where multiple races live side by side, this is often interpreted as racial profiling, in that certain races are more closely monitored than others. And if a crime is reported and the alleged perpetrator belongs to a race that is profiled, the police react faster and more aggressively. And the justice system, if it gets that far, metes out a tougher penalty than would be the case for other races. This is a factual summary of how policing works in some countries where race is a controversial theme. What about in countries in which the racial demographic is homogeneous? Everyone is one race. How do the police collect intelligence on which groups to monitor? Your guess is as good as mine, but I would venture it would be the young men 12 to 25 age group. Why? In one word, testosterone. We don't need to be PhD endocrinology doctors to understand that male aggression, risk-taking and accident-prone probability is high because of, biological factors. And all of these factors are mediated primarily by testosterone. It's not a study that would be deemed ethical to carry out, of course, but if you castrate a group of young males, the crime rate in their community will suddenly drop overnight. And of course, the reason older men are not included in this profiling is simply down to the reduction of natural testosterone production within normal healthy aging or within normal healthy older men. But that's just the purely medical. On a social level, we also understand that older males and females for that matter are also more experienced, more level-headed, and more likely, therefore, to follow the law of the land because of their social conditioning. There are, of course, reports of increased aggression among young females, by the way. Whilst I have not personally seen any reports of physical or medical reasons for this, and here I plead for further information. Has anyone seen any medical data suggesting that females are somehow acquiring more testosterone compared to previous generations of females? I certainly see the social conditioning that leads to this image. And the "you go girl" mantras are some examples. Whatever the source of this rise in female aggression, we see a corresponding reaction from the police towards young women in a way that we never saw before. So my point is, an institution like the police, the justice system, and so forth, gather information, intelligence, and act accordingly. This means that equality must be a fallacy before the law and before law enforcement. This is the reality of our world. Equality cannot be realized because different groups have to be treated differently because of intelligence gathered on all groups within a society, within a land, within a country. So, whilst equality, for good or bad, for better or worse, is a beautiful concept in principle, in theory, it cannot really be applied in the reality of day-to-day life. What about medicine? Are all people equal in the eyes of medicine? Yes and no. Yes, in the sense of every being having the same right to dignity, respect, and care, and being of the same value. But of course, no, because there are concrete physical differences between different demographics, which means disease detection and treatment must be based on intelligence gathered in a similar way to the procedure of the police. There are known associations within medicine. Consider in this video the board exam type question I posted relating to saddle nose or syphilis nose. I repeat the question here. What is the likely occupation of this patient? A. Butcher, B. Opera singer, C. Sailor. Please close your ears if you are or were a sailor or your loved one is or was. For good or bad, that's the reputation of sailors. And medical teaching is not shy to perpetuate this narrative. So much so that every board exam question on sexually transmitted disease is linked to a sailor if the patient is a man. So a typical question might go something like this. Mr. Smith served in the US Navy and was posted to Vietnam during the Vietnam War. He presents to you with a cough, fever, and weight loss. Here is his chest radiograph. In such a question, you can almost guarantee that the chest radiograph shows something along the lines of a sexually transmitted related illness, usually atypical tuberculosis, which is itself linked to HIV infection or something similar. The fact is, in a board exam question, if you see the word sailor, you know you are being tested on your knowledge of sexually transmitted diseases. Where the patient is a woman, the occupation would be lady of the night or sex worker, which of course makes sense. By the way, I am also reliably informed that quite controversially, it became quite trendy in the 90s and early 2000s to use a gay man of any profession as the subject of an HIV-related illness. This quickly fell out of favor. I'm guessing from the backlash linked to societal stigma issues. So, not only race, age, gender, but also sexual orientation and profession are very much profiled in medicine. I can tell you that medicine has a self-depreciating side, which makes me laugh sometimes. In the same board exam type questions that I present previously in this video, if the patient is a doctor or a journalist, you are dealing with an alcohol-related problem. This is true. Medicine profiles itself as the typical subject of alcohol abuse. The question may go something like this. You are called to the ER because a blue light, shorthand for ambulance, has just brought in a 55-year-old man you recognize to be the chief of surgery in a neighboring hospital. You are asked to review his lab results. After doing so, you ask to see him. Here he is. And you are supposed to pick up the fact that his face is rather jaundiced, so it's looking a bit yellow, and he has hematoma, bruises on his arms, which are both a sign of severe liver disease. Of course, there are many causes of liver disease, cirrhosis of the liver, for example, but the fact that his profession is doctor or journalist is your big clue that we are talking about alcohol here. In the UK, if you're taking a board type exam, you can add pub landlord or landlady to that list of alcohol-related professions. This is all facts. I'm giving you secrets of the trade here. You have all, I suspect, heard this joke. You are only an alcoholic if you drink more than your doctor. If you still think it's just a joke, after the examples I give above, then I have a bridge to sell you. In addition to the person, there are associations with places too. If you have diarrhea lasting more than 3 or 4 days, your GP or ER doctor wants to know where you have been in the last 3 months. Any tropical country is on the hit list here. There is a condition of the eye known as pterygium, spelled Pteryigium, which is only found in people who have lived a long time in a tropical country. If you have this, the first question from your doctor will be, where have you come from? Or where have you been? Sometimes it is very important to know the generic or the genetic origin of a patient. In the investigation of an anemia, for instance, you could save yourself countless investigations, including a colonoscopy, a look up the intestine from below, if you are obviously of Southern European origin, for example. If you have roots in Greece, Turkey, or Italy, because then your doctor will focus on simple, cheap tests, focusing on excluding an as of yet undiagnosed thalassemia, for example, which is a blood disorder affecting people of Mediterranean origin, which quickly leads to an anemia. This will save you a fortune in unnecessary tests like a colonoscopy, where in the absence of other causes of anemia, your doctor must and should exclude a bleeding colon tumor, for example, especially if you are of a certain age and especially if you're male, because amongst the females, your doctor may consider menstrual bleeding patterns to be a possible cause. So if you are male or a woman above the age of reproduction, then a colonoscopy will be part of your investigation for anemia. I talk a little bit about anemias and thalassemia in this video. In this kind of case, your medical profiling pays off because you save yourself some money and time, not going down the rabbit hole along the wrong path, investigating something that another simpler test will exclude. So it's not all negative, medical profiling. Sometimes it has its benefits. The point point of all of this is to highlight this aspect of medicine that is rather like computer coding. It is hidden, but without it, your healthcare algorithms cannot function properly. Insurance companies, for example, use this intelligence against you or for you all the time. When you fill in an insurance form, you are heavily penalized if you're a smoker, you're diabetic, or are above a certain age or weight. You simply pay a higher premium. That's perhaps a form of discrimination that is a bit fairer, I suppose, than the 3 isms in the title of this video. You can change your lifestyle habits and your profession, but not your race, your gender, and your age. Well, you can apparently change your gender, but only superficially, of course. The biological characteristics and risk profile does not change with gender reveal surgery. Medicine prides itself on being a common sense profession. I can't tell you how many times I have heard the phrase, if it looks like a duck, it moves like a duck, it smells like a duck, it sounds like a duck, it speaks like a duck, it tastes like a duck, it feels like a duck, it is a duck. The question, could it be a dog? However, is never far from my thoughts. But I wouldn't dare voice that out in the context of an exam. Occasionally, like once every 6 years, I find a dog among the ducks. But 99% of the time, yes, it is a duck. It's all about pattern recognition. Your doctor is trained to see patterns in everything, to think in a certain way. Not much room for reinventing the wheel. Because, although it may be true that the human body is evolving all the time, this evolution is way too slow for any exciting changes to ruffle the feathers of the old man we call medicine. What do you make of medical profiling? Do you think it is useful? Or is it just discrimination dressed up as intelligence, a la police force profiling in most Western countries? Or in any country of the world, actually? Does it help you to know that much of medicine is simply pattern recognition? Do you have personal stories of having been medically profiled yourself, or has this happened to a loved one? Whatever the case, stay healthy. And any questions or comments, do feel free to ask a doc.